I welcome you to the Healthy Heart, Healthy Life Pune session 12, in which we are going to discuss the very important topic of what happens when somebody gets a heart attack. I am Dr. Neelkant Karandikar, Chief Cardiologist at the Heart Clinic in Mukundnagar, Alpha Diagnostics Tilak Road, Interventional Cardiologist at Ruby Hall Clinic, Dinanath Mangeshkar Hospital and Sahyadri Hospitals. I'm Honorary Professor Emeritus in Cardiology and the first gold medalist of the Bombay, now Mumbai University. No beauty shines brighter than a healthy heart. How true this statement is. And today we are going to discuss about something which really goes to destroy the beauty of the heart and which we can prevent from happening. We know that our heart is the body's power pump, and here are the chambers shown. The ventricles are the muscular chambers which pump blood, the left ventricle, into the entire body through the big artery aorta, and the right ventricle through the pulmonary artery to the lungs. When heart attack strikes the heart, it mainly strikes the left ventricle, which is the pump which sends blood to the entire body and weakens the heart. When heart attack occurs, cholesterol containing deposits build up over time, forming plaques in the heart's arteries. This is, of course, the stage before the heart attack occurs. Here you can see that there is a cholesterol deposit here, as it is shown in yellow, at this point in the coronary artery supplying blood to the heart, and the blood clot has formed, and this darkened area is the area where the heart attack occurs. A heart attack occurs when an artery that sends blood and oxygen to the heart is blocked. If a plaque ruptures, a blood clot can form, as is shown over here. The blood clot has formed when this plaque has ruptured. The clot can block arteries, causing a heart attack. During a heart attack, a lack of blood flow causes the tissue in the heart muscles to die, or we can say start dying, a process which extends over a course of time, about which we'll discuss right away. An artery supplying to the heart muscle is blocked with a plaque which ruptures and there is a blood clot formed and this artery gets blocked. And up to 1 billion heart cells can die because of oxygen starvation. This is what happens in a heart attack. Blocked artery, the muscle cells called myocytes of the myocardium start dying. Now, this is a very important diagram. Here, the heart artery, coronary artery, suppose it gets blocked. For the first few minutes, maybe through collaterals or anything, other reasons, the destruction of the heart muscle cells does not happen. But then there is a rapid onset of cell death, and within a period of 3 to 4 hours, maximum number of cells which are being supplied by the blocked artery are dead. Now, the goal is in the mortality is to reduce the mortality, and if within 1 hour the artery which was blocked is opened up, almost 80% of the muscle can be salvaged, and even more could be salvaged. But if you delay things in opening the artery, then more and more cells start dying. By say 6 hours or so, almost entire area supplied by the artery is gone. The golden hour for a heart attack refers to the first 60 minutes after symptoms begin, during which prompt medical intervention is crucial to save heart muscle, prevent permanent damage. significantly improve survival and recovery as the heart muscle starts dying quickly if there is no blood flow. During the first 4 hours of a heart attack, rapid damage occurs as heart muscle dies from lack of oxygen. Significant irreversible damage potentially starting after 90 minutes of the blockage in the artery and nearly complete tissue death by 6 hours. Only little bit of tissue is remaining, and that destruction of that tissue can continue even up to 24 hours. Now, if the blocked artery is not opened up, you're somewhere on a trip in a village, there is no nearby hospital, no drugs available, nothing. Then what happens? Then this part, which is shown in dark, gets damaged forever, permanently damaged. And the rest of the heart muscle has to compensate, further deteriorating the heart muscle function. So, if this part is damaged, the rest of the heart has to compensate. And in this part, what happens? Scar tissue forms, obstructing the function of the heart, right? Suppose you insert a block of wood in a furnace, you know, previously there used to be furnaces, there used to be sort of ovens and furnaces and things like that in times of cold. Now, once that wood starts burning and once it is totally burnt, it is gone, it is like scar. So before that happens, we have to recover the heart. Now, once that scar has formed, this is the area where the heart attack occurs. Later on, what happens? This scar tissue can expand, what is called as infarct expansion, right? There is infarct expansion. LV is the main chamber of the heart. There is a dilatation of the chamber, myocardial thinning. This part of the heart starts thinning out, and finally, the power of the heart goes down, and there is heart failure. So this is acute myocardial infarction, that is a heart attack, and this is adverse remodeling. That means the undesirable changes in shape of the heart, which weaken the heart, which reduce the power of the heart, which reduce the ejection fraction, as we call in our medical terms, cardiology terms, which reduce the ejection fraction. Normal ejection fraction, 55 to 75 or 50 to 75%. But then if it comes to around 40, 35, we say mildly depressed, 35 to 25, moderately depressed, less than 25, severely depressed heart function. Now, factors determining the size of the heart attack. What are the factors which determine the size of the heart attack? The artery blocked. Which artery is blocked? A blockage in a major coronary artery leads to more extensive damage than a blockage in a smaller branch. Let me come to this figure. If this artery is blocked here in the middle, you will get a heart attack. Definitely, if it was blocked here, it will be a bigger heart attack. If it is blocked here, it will be a smaller heart attack, right? So the size of the artery is important. Next, the duration. The longer the blood flow is cut off, the more the heart muscle is deprived of oxygen and greater the damage will be. We have already seen that if the blocked artery is opened within 1 hour, which is called as the golden hour, then there is a substantial reduction in dying of the cells of the heart, and the muscle of the heart is sort of saved to a great extent in the golden hour. But if the blockage remains for a longer time, say 4 to 6 hours, almost entire muscle in the area supplied by that artery becomes dead. So the duration, the longer the blood flow is cut off, the more the heart muscle is deprived of oxygen and greater the damage will be. Of Very, very important is the extent of muscle affected. A small heart attack might involve only 5 to 10% of heart muscle, while a severe or big heart attack could affect 30 to 40% of more. Let us get back to the figure. Now, if the blockage was in the distal part of the artery, as is shown by this black arrow, only a small part would get affected. But if the blockage was in a big artery, as soon as it arises from the aorta, uh, then you will get a big heart attack. Sometimes there is a sudden death also. So the area, the site where the block occurs will decide, and small heart attack, small muscle involved, big heart attack, large amount of muscle is involved. And the last is, of course, collaterals. This again is basically explained in this diagram. If the block has increased slowly over months or years, then there are collaterals from the other coronary artery which start supplying the area which is deprived of blood flow because of this block. And the heart attack will be smaller. But if the block has increased rapidly, as it is mentioned, they are rapidly progressing atherosclerosis, then the heart attack will be bigger because there is no time for the collaterals to develop. So, factors determining the size of the heart attack is depending on the where the artery is blocked, the duration of the block, the extent of the muscle affected, and the collaterals. Very, very important four factors. Symptoms and severity. The intensity of symptoms or complaints often correlates with the size of the area affected. Often, not always. Small heart attacks, symptoms can be mild chest pain, confusing, or even absent, which is called as a silent heart attack. We have seen that in our previous session. People might mistake these symptoms for indigestion, fatigue, or stress. The damage may be limited, but still indicates significant underlying heart disease and an increased risk of a future more severe heart attack. So even if you have developed a small heart attack, as is detected by the tests conducted by the cardiologist, even then you have to be extremely careful. You're lucky you did not get the big heart attack at the first time, and you must take care that you don't get a big heart attack in the future. Now, as far as the big heart attacks are concerned, these typically present with intense, unmistakable symptoms like crushing chest pain, shortness of breath, severe nausea, pain, sweating, and the pain radiating to arm, jaw, neck, or even sometimes the back. So these symptoms most of the times correlate with the severity of the heart attack, but not always. Now, when you suspect a heart attack, if you suspect you or someone else is having a heart attack, call emergency services immediately, even if symptoms seem mild, as prompt treatment can significantly limit heart damage and improve survival rates. For more information or on warning signs, you must watch my future sessions definitely. Now, many countries have emergency services. I was very, I was very, very pleasantly surprised that this has been shown in Israel. In Israel, within minutes or an hour, you can get an ambulance at the site of the place where the person has developed a heart attack. In fact, any severe problem, any severe disease, and that person is taken to the nearby hospital, treatment given, and if the treatment of the heart attack starts or is done in the golden hour, that is the first hour after starting of chest pain or other symptoms, significant part of the heart can be saved from getting dead or destroyed or dysfunctional. Thank you very much for attending this session. I think this understanding of what happens during a heart attack is very, very crucial. And when we know that heart muscle is equal to the time that is, you take to rush the patient to the hospital. Once you realize that and you take immediate and appropriate action for a person suspected of having a heart attack, you will save a lot of lives. Thank you very much uh, for attending this session. And I'm going to describe the features of heart attack in subsequent so many sessions also. There'll be several sessions on heart attack, which is a very, very important subject. Please subscribe to my channel if you're not already subscribed. Recommend it to your friends and relatives, and also give me a thumbs up, which will encourage me to continue giving important information to you. Thank you very much. Thanks a lot.